Hello, this is our poster on our research of the Counselling and Multidisciplinary Care for Women with Fetuses Affected with Trisomy 18 Edwards Syndrome, a survey of fetal medical professionals in the UK. Introduction. Infant mortality rate in the first year of an infant with Trisomy 18 is approximately 75 to 95%. Due to the associated morbidities, the extent of this means that the care and management of Trisomy 18 has been palliative despite a recent shift in studies towards aggressive treatment with frequent surgeries. Though this shift has prolonged survival in some, such treatments are being scrutinized and ethically challenged, especially regarding the survival rates and subsequent quality of life. A common intervention for Trisomy 18 infants is cardiac surgery to correct congenital heart defects, as it improves prognosis in some. These treatments have resulted affected mothers presenting this research and news articles of similar cases in order to receive treatment for their fetus. A case study was conducted following a 41-year-old pregnant female who received a diagnosis at 21 weeks and 3 days gestation. Termination of pregnancy was discussed, which due to gestational age would involve feticide, or the care she could be offered if pregnancy was continued. An MDT meeting was held at 32 weeks and 3 days gestation. The mother wanted to discuss the possibility of cardiac intervention. She was counselled that the prognosis was poor. The mother stated that she did not want her baby to be disregarded and was counselled that it would not be in the baby's best interest to have cardiac surgery, and a meeting with the fetal cardiologist was held. It was discussed that if a baby was born in a critical condition, they should opt for supportive, non-interventional care, which she understood. However, if the baby were to be born stable with cardiac medical care, she was keen to discuss surgical options. At 39 weeks and 5 days, the mother gave birth to a boy. The baby sadly passed away early on into the neonatal period. This case suggests the importance of good counselling for family involved, which was provided here. However, some family members still feel like their baby is being disregarded due to them not being a suitable candidate to receive interventional surgeries or procedures. It also shows how many parents choose to carry out their own research or seek out secondary opinions. Therefore, we decided to create a survey to fetal medicine doctors and midwives exploring their views and experiences of caring for women with a fetus affected with Trisomy 18, focusing specifically on the counselling provided and information on chances of survival beyond the neonatal period. For our methodology, we began with preliminary research using peer-reviewed publications and media articles to form the initial questions proposed. These were then refined through discussion with fetal medical specialists. Once completed, the survey was circulated via Google Forms to contacts in various UK units, including Leeds, Manchester, London, Birmingham, Bristol, and Northern Ireland, and was finally sent to the British Maternal and Fetal Medicine Society Secretary and was circulated within the UK. The survey was open from the 28th of the 2nd, 2022 to the 31st of the 3rd, 2022.
Outcomes. Once our survey was circulated, numerous healthcare professionals responded, including consultants, specialist trainee doctors, midwives, and specialist fetal nurses. And they all reported their views and experiences of families affected by Trisomy 18. All respondents of the survey reported that they regarded Trisomy 18 as a lethal condition. When participants were questioned about counselling, 97.5% of responses contained the terms termination or terminating. Impacts. Trisomy 18 is a significant diagnosis for any family to receive. The more we understand the syndrome and the different pathways for management, the better the impact healthcare professionals can have on a family coming to terms with this diagnosis. With more surveys, research projects, and posters being produced, hopefully it can open up the discussion regarding Trisomy 18 further. Thank you for listening to our presentation of the poster, and just to introduce ourselves, my name's Erin Court.
And I'm Helen Brissenthwaite.
And we're two fourth-year medical students at the University of Liverpool. We have been working with our supervisor at the Liverpool Women's Hospital, Dr. Kate Natharatnam, and we've also been working with Dr. Umba Agarwal to help develop our poster. We would like to take the opportunity to thank both of them, both Dr. Navratnam and Dr. Agarwal, for helping us on this project. Thank you.
Thank you.